Hello, everyone. Good evening. Hi. It's Thursday, so we have our Facebook Live on nursing prioritization and delegation. I would like to welcome everybody who's here joining us for this very quick session for tonight only. So we have questions on prioritization as well as delegation again. Okay, so every Thursday, just keep on posted if there's any announcement for this Facebook live. So usually we have to post the announcement. Okay. Anyway, so thank you for joining again. Before anything else, my name is Mr. Alan Matus, and I am a nurse educator. I have been teaching students for more than 25 years. I'm an NCLEX specialist also. I like teaching NCLEX, of course. I'm also faculty of the nursing program. I teach students on how to pass their subjects, and of course, upon graduation as well, I prepare them for the examination also. Now, if you don't know yet, I'm also an author of a book that I published in Amazon. The title of the book is Simple, Fast, and Easy NCLEX Review that you can find in Amazon, everyone. So grab the book. It's in ebook version or Kindle version, and there's also, of course, a paperback print version. And as you can see, it has a 5-star rating. Until now, I think we have already 117 reviews for this book. So, yes, and of course, the new edition will be coming up by next year. We're updating the book, of course. Okay. All right. So that's my book in Amazon, everyone. So grab a copy. And for those who like the book and have the copy of the book right now, can you please give a shout out, everybody? Okay. All right. So next, I would like to make an announcement about our 10-day live comprehensive NCLEX review webinar. So our schedule next, tentatively, will be on October 16 to December 18, 2021. That will be every Saturday from 8 to 4:30 p.m. So it's a 10-day live comprehensive NCLEX review webinar. So for those who graduated many years ago or new graduates who want to solidify or strengthen their content for nursing review before the NCLEX, then this is the class for you. If you want to remember all the very important concepts that you need to know before you can develop your critical thinking. So the review class comes with a workbook and, of course, a lot of resources in our online NCLEX Academy. So even after the program, you will have access to our online resources for practice exams, and of course, recorded videos as well. So check our website, matusnursing.review.com, or our online website, which is the Matus Nursing Review Academy.com for the online NCLEX Academy. You can also shoot us an email, and you can see that on the screen. That would be info@matusnursingreview.com. We're also planning to do a live class, so we'll see how it goes. Right now, we have the whole COVID situation, but if there is a live classroom, then that will be announced as well. So the plan is to have the live webinar and the virtual class, the live webinar and the live classroom together in one session. So I'll be having students in the live class, and at the same time, there are students joining me virtually as well, yeah, via Zoom probably. So let me know your thoughts about that. So we're gonna have a live classroom and then also virtual. So meaning some students are online and some students are in live person during the class, so that other students from other countries or other states can also join the class during our 10-day live comprehensive NCLEX review, everybody. So keep posted for further announcements in our Facebook page, guys. Okay, so before I start further or go further, I would like to welcome some students for tonight. So we have the first few ones who signed in. So I would like to give them a congratulations for being the first persons to come in here, the first few people. So we have Clarissa May Siadanao, Chike Eke, Yoshika Singh, Halimat Alime. We also have Garcia Layan, Fresa Dag Paz, Rich Jan Ricardo, Dayan Oliva Bolido. And also just a reminder, everybody, what you can do is that make sure that you click that notification button for your Facebook, okay, in your Facebook, so that whenever we have posting about announcements or when we go live, you can receive the notification. Okay, so just make sure of that, guys. So turn on your notification bell. So also, okay, so we have nice messages here. Let me see. Let me read first. So we have okay. So okay, so hi Diane. Okay. All right. Anyway, so we also have our testimonial as usual. A student who passed the NCLEX recently, and she has been joining our Facebook Live for the longest time already. And finally, Mulu has finally passed her NCLEX, and she sent us this very inspiring testimonial about her experience. So she says, I am finally a licensed RN in the US. I graduated more than 20 years ago in Ethiopia. When I was studying for the NCLEX-RN exam, I searched if there were any good Facebook Live teachers. When I came across Matus Nursing, I decided to stick around and participate every Thursday. Eventually, I was lucky enough to win the 90 days free trial from Mr. Matus. I love the way Mr. Matus tonight teaches class. His tips suck as strategies, prioritization, and delegation. Mr. Matus' course helped me a lot. It made me more confident and ready for the real exam. I highly recommend 100% that you use Matus study resources to study for your NCLEX exam. So Mulu actually was one of our winners for the in the Facebook Live. So she got 90 days access, and she's really very happy about that. So thank you very much, Mulu, for your recommendation or review, and we wish you good luck, big time, finally on your nursing career. And I'm really very happy that you finally passed the NCLEX examination. Can you imagine that 20 years of being a nurse and now finally achieving your dream? You need to be an RN. So congratulations for that. Okay, and of course for tonight, all right, so we are going to have your free 90-day online access and NCLEX review. So whoever wins tonight, stay over, check if we luckily draw your names. I want everybody to win, but the computer only will choose one winner for tonight. So we'll post the video after this, okay? So make sure that you keep posted and find out if you're the winner. And of course, if possible, guys, share this with your friends, um, this Facebook Live, so that they will also benefit. And at the same time, if you're watching in YouTube, please click subscribe. So we we started to think that we want to reach more subscribers in YouTube. So right now we have like 5,000 subscribers, and our goal is to reach 10,000 by the end of the year. So I'm not really very sure, guys, if that's possible, but if you could help me out to reach 10,000 subscriber before the end of the year. Okay, so we had increased numbers of subscribers last year, so hopefully we can reach that. Okay, and also it will definitely benefit your classmates as well. All right, guys, so let's find out if you're ready for the first question, everybody, okay? All right, so for our first question, thank you very much, Yoshika, for sharing. Yoshika has always been in our Facebook Live, and thank you very much for being so interested all the time, Yoshika. Pratiksa Patel is also here, okay? And Mike Serafico as well, okay? All right, so let's have the first question. This question is going to be about prioritization. Okay, so I will read the question, guys. So the nurse cares for several clients in the post-anesthesia care unit, or PACU or PACU. Which client requires immediate intervention? A, the 38-year-old client who complains of nausea after stapedectomy surgery. B, the 45-year-old client who develops lymphedema of the right arm after a radical mastectomy. C, the 59-year-old client who has a BP of 150 over 150 millimeters of mercury, which is systolic, and widened pulse pressure after a craniotomy. And letter D, the 25-year-old client who was a paralytic ileus after sigmoid colostomy surgery. So again, I'll read the question. The nurse cares for several clients in the post-anesthesia care unit or PACU. Which client requires immediate intervention? A, the 38-year-old client who complains of nausea after a stapedectomy surgery. B, the 45-year-old client who develops lymphedema of the right arm after radical mastectomy. C, the 59-year-old client who has a BP of 150 systolic millimeters of mercury and widened pulse pressure after a craniotomy. And D, the 25-year-old client who has paralytic ileus after a sigmoid colostomy surgery. So please put your rational, okay, put your rational for the answer that you have chosen. So remember that this is a prioritization question, which basically is the integration of all knowledge that you have about nursing. So I would say that prioritization is almost like you need to have very strong content of everything to be able to answer these questions right. So that's why I would always advise students that when it comes to prioritization, make sure that you really have very good strong content. So, okay. So I think everybody has their answer. Let me see if everybody got the right answer. Okay, so the answer to this question, everyone, is going to be all right. So I think most of you got the answers right. Very good. So this is a straight to the point question. Very good. So that'll be letter C. The client who has craniotomy with blood pressure systolic of 150 over 150 millimeters of mercury and widened pulse pressure. Because we all know that in your increased intracranial pressure, you have a rising blood pressure, especially the systolic, and then you also have widened pulse pressure. Now, first, what is pulse pressure? Pulse pressure is the difference between your systolic and your diastolic. So for example, if you have a blood pressure of 120 over 80, your pulse pressure is going to be 40 because 120 minus 80 is 40. In increased ICP, that will be widened, meaning the number is going to become bigger. So this vital signs that you have in this question is what you call the Cushing's triad in patients with increased ICP. And when you take the NCLEX, everybody, you should know the Cushing's triad in increased ICP. So what is the Cushing's triad, or what are the components of the Cushing's triad? So you have vital signs that are the opposite of shock. So you will have a rising blood pressure, especially the systolic, widening pulse pressure, bradycardia or reduced heart rate. Okay, bradycardia or reduced heart rate. So those are the components of your Cushing's triad. And also don't forget that in increased ICP, you also have sometimes Cheyne-Stokes respiration or decreased respiration. Okay, so don't forget your Cushing's triad in patients with increased ICP. And after this, I'm going to have to post information in the comment section, additional information about increased ICP. Okay, so why is A not the answer? Because A, nausea after stapedectomy surgery is a little bit expected. Stapedectomy is surgery of the ear, and a common reaction or effect of ear surgery is nausea. Okay. Now, letter B, lymphedema requires attention. However, it's not as important as letter C. And letter D, paralytic ileus. So after a major gastrointestinal surgery, it is expected that temporarily your patient will have paralytic ileus or the lack of peristalsis. Okay, so until the bowel sounds return, evidenced by the passage of flatus or listening to your bowel sounds, everyone. Okay, so letter C is the best answer, and I'm very happy that everyone got the right answer. Okay, all right. So let's have the next question, everyone. So Yoshika Singh said because there is increased ICP. Okay. So letter C, very good. Okay. Which client should the nurse assign to a new graduate nurse in the neurology unit? So this is more of delegation now. Okay. A, the 42-year-old client who returns to the unit after an EEG procedure. B, the 55-year-old client who is recovering after a supratentorial craniotomy surgery. C, the 48-year-old client recently admitted for thoracic spinal cord injury. Or D, the 32-year-old client who is newly diagnosed as having myasthenia gravis. Okay, which client should a church nurse assign to a new graduate nurse in the neurology unit? A, the 42-year-old client who returns to the unit after an EEG procedure. B, the 55-year-old client who is recovering after a supratentorial craniotomy surgery. C, the 48-year-old client recently admitted for thoracic spinal cord injury. Or letter D, the 32-year-old client who is newly diagnosed as having myasthenia gravis. And to be honest with you guys, these questions are like NCLEX, because NCLEX is like this. The questions are not tricky. The questions are usually direct to the point, and you should really know the answer. And I would like to give a shout out to Janine Lubaton. Hi, Janine. Janine actually is already an NCLEX passer. Can you please put the state or the country that you're coming from, everyone? We would like to find out your location as well. Okay. And how did you hear about our program, about our Facebook Live, everyone? Okay, very good. And I think everybody got the right answer to this question. Let me see very quickly, guys, without further ado. Okay, you're all correct. The answer is going to be letter A, electroencephalogram. Very good. Electroencephalogram procedure, that would be letter A. But I would like to remind everybody that we always said in the past, that um, when we have to assign task or clients to a new graduate nurse, it has to be always a stable patient. So letter A is the most stable because of the fact that this is only an EEG or electroencephalogram. You all know that electroencephalogram is a non-invasive procedure, a little preparation only, aside from preparing the scalp of your patient, the hair shampoo, but definitely letter A is the most stable. Although we said in the past that anyone who returns from surgery or diagnostic procedure could be a priority, however, or unstable. But letter A is not really unstable, although this person is returning from a procedure. Okay, so if it is a major procedure, for example, like colonoscopy or cardiac catheterization, so I think that those would be unstable patient. Letter A, that's only an EEG procedure. Okay. Now, if you look at letter B, that is really an unstable patient, obviously. You have brain surgery there. Letter C, that would be a spinal cord injury. And letter D, that would be myasthenia gravis. The keyword is new diagnosis. A new diagnosis of a very serious condition, which is myasthenia gravis. And we all know that myasthenia gravis is characterized by muscle weakness, and characterized also by crisis, with under medication, the patient can go into myasthenic crisis. Okay, so that patient requires is a little bit more unstable, needs more teaching as well because of the new condition. So letter A is the answer, everyone. Very good. Congratulations. Okay, let's go to the next question, everyone. That will be delegation question again. And Joyce is from Saudi Arabia. We also have Vincent is from Florida. Minnesota is Rebecca. Okay, from Dallas is Bobby. Very good. Hi, Bobby. And then also from California, Shane. Okay. And Yoshika, thank you very much for your rationalization. Okay, A was the answer for that because C and D are both are recently admitted, and the last one is newly diagnosed. Very good. Okay. So Noel Burgos is from Kingdom of Saudi Arabia. So let's have the number 3 question, guys. So number 3, which of the following tasks may be delegated by the registered nurse to the licensed practical nurse or LPN when caring for a client recovering from an open cholecystectomy procedure? From an open cholecystectomy procedure. A, assist the client during deep breathing and coughing exercises. B, teach the client on how to splint the incision site using a pillow. C, assess the insertion site and drainage of the T-tube. And D, develop a dietary plan before discharge. Okay? Again, which of the following tasks may be delegated by the registered nurse to the licensed practical nurse when caring for a client recovering from an open cholecystectomy procedure? A. Assist the client during deep breathing and coughing exercises. B. Teach the client on how to splint the incision site using a pillow. C. Assess the insertion site and drainage of the tube. And letter D. Develop a dietary plan before discharge. Okay? All right, everybody, put your final answers now. Okay? All right, so the answer to this question, everyone, will be... All right, so the answer is going to be... Let's see. The answer is going to be letter A, everybody. Okay? So the answer is letter A, assist the client during deep breathing and coughing exercises. Okay, so letter A, that is something that an LPN can do, assisting the client during your deep breathing and coughing exercises, right? Your letter B, your C, and your D, teach the client on how to splint the incision site using a pillow. That is for the RN. Your letter C, assessing the insertion site and drainage of the T-tube. That is a comprehensive assessment after surgery. That should be done by the RN. And letter D, develop a dietary plan before discharge. That is the responsibility of the RN as well. So letter D, you're planning. As what we have said in this class before, we said that the RN is not supposed to delegate eat or tape. You know, your letter T is your teaching, your A is your assessment, your letter P is planning, and letter E is evaluation. So all of those should be done by the registered nurse, everyone. Okay, now letter A is going to be assist the client during deep breathing and coughing. That's okay. After surgery, the LPN can also assist the client on how to use the incentive spirometer. So those are within the scope of practice of the LPN, as long as your patient is stable. Okay, all right, very good. So for that question, we have, okay, good rationalization from you, everyone. Now let's have the last question for tonight. Okay. All right, so very easy question again. Hopefully, I really hope that when you take your NCLEX, you have a very good understanding of delegation, everyone, because if you can remember, coordinated care or management of care is a big part of your test plan. It is a big part of the test plan, so you can really see these questions on coordinated care and delegation. So which of the following are appropriate tasks to delegate to the unlicensed assistive personnel or UAP when caring for a client who has acute bronchitis? Select all that apply. A. Teach the client on the importance of hydration therapy. B. Plan activities with rest periods to conserve energy. C. Assist the client during repositioning. D. Remind the client to drink fluids as recommended. E. Determine the characteristics of the sputum within the shift. Again, which of the following are appropriate tasks to delegate to the unlicensed assistive personnel or UAP when caring for a client with acute bronchitis? Select all that apply. A. Teach the client on the importance of hydration therapy. B. Plan activities with rest periods to conserve energy. C. Assist the client during repositioning procedure or repositioning. D. Remind the client to drink fluids as recommended. E. Determine the characteristics of the sputum within the shift. Then give your rationale again, everyone, why you answered 1, 2, or 3, or A, B, C, D, and E. And remember in the NCLEX, we said this, that in the NCLEX, your select all that apply questions can either have one answer or everything will be the answer. So it's either one or all or some of them only. And the best way to answer your select all that apply is to treat each option like a true or false statement. All right, everyone. I can see that everybody has given their answers. Okay, so let's see what's the final answer, everybody. All right, so the answer, everyone, is going to be letter C and D. Congratulations to a lot of you guys got the correct answer. Okay, so you have letter C and D because letter C, repositioning, is of course part of the scope of practice of the UAP. We have discussed that over here for a long time. Reminding the client to drink fluids as recommended is okay as long as it is not teaching the client on the importance of hydration therapy. So that will be letter D is okay. That's also included. Now, can you see the difference between A and letter D? Letter A says teach the client on the importance of hydration therapy. That will be for the RN. Okay. But letter D, reminding the client to drink fluids as recommended, it means to say that it is within the scope of practice of your UAP. Of course, they can remind clients to drink fluids or change positions, as part of the recommendation. Okay, so total your scores for tonight, everyone. Okay, so let's see. What's your score, everybody? Of course, before anything else, we're gonna have a quick shout out regarding our program, everyone. So we have, everyone the program. Okay, so the online NCLEX Academy. So what are some of the features of our online NCLEX Academy? So we have interactive core content review, a highly organized and up-to-date test plan-based curriculum, NCLEX Success Workbook. So a lot of students like the NCLEX Success Workbook. A study plan checklist, hundreds of end-of-lessons quizzes, final NCLEX predictor assessment exams, our Facebook Live video recordings. You have access to them in the Academy. And of course, your Facebook discussion group as well with questions. Okay? All right, so we'll see who wins for tonight. Okay, and also we have our merchandise products, guys. Think positive, I can do it. Okay, just visit matusnursingreview.com or matusnursingreviewacademy.com to have these products as part of the Matus tribe, everyone. Okay, all right. Okay, so did you total your scores, everybody? So Yoshika says, thank you, sir. Your FB Lives always helps to boost my confidence. Thank you very much for appreciating that. And also, you can watch the videos in YouTube as well. Okay, so all of this is now, we have a lot of sessions already since last year. So you can watch them in YouTube. Joy says 4/4 for tonight. Congratulations for that, too. And of course, we would like to congratulate Gerwin Cedilio Atubig for winning our previous Facebook Live. So the last time. Okay. So share the good news and this Facebook Live session with your friends so that it will also benefit everybody. And of course, I would like to thank everyone for being here tonight. And next week, we'll have more exciting questions for you guys. But again, just wait for any announcement or posting in our Facebook and turn on your notification, everyone. So again, this is Mr. Alan, where we make simple, fast, and easy NCLEX review for you guys. And again, don't forget we have live webinars coming up, and then also our self-study programs, everyone. Okay, so if you have any question, post your questions in the comment section. Okay, or you can also send us a message or an email. So good night, everyone, and have a great night.